The shoulder is one of the most complex and mobile joints in the human body, allowing for a wide range of motion. In this video, we'll break down its key muscle groups, their origins, insertions, and functions. First is the deltoid muscle. This large triangular muscle covers the shoulder and is responsible for arm abduction, flexion, and extension. It consists of three parts: the anterior, middle, and posterior fibers. It originates from the lateral third of the clavicle, the acromion and spine of the scapula. It inserts into the deltoid tuberosity on the humerus. The anterior fibers assist in shoulder flexion and medial rotation. The middle fibers are responsible for arm abduction, and the posterior fibers contribute to extension and lateral rotation of the shoulder. Next, we have the rotator cuff muscles. This is a group of 4 muscles that stabilize the shoulder joint and enable precise movement. These muscles include the supraspinatus muscle. This muscle originates from the supraspinous fossa of the scapula. It inserts on the greater tubercle of the humerus. It initiates arm abduction and helps to stabilize the humeral head in the glenoid cavity. The infraspinatus muscle originates from the infraspinous fossa of the scapula. It inserts on the greater tubercle of the humerus and assists in external rotation and stabilization of the shoulder joint. The Teres Major originates from the lateral border of the scapula. It inserts on the greater tubercle of the humerus and aids in external rotation and stability of the shoulder joint. The Subscapularis muscle originates from the subscapular fossa of the scapula. It inserts on the lesser tubercle of the humerus and facilitates internal rotation and adduction of the shoulder. The Supraspinatus, the Infraspinatus, the Teres Major, and the Subscapularis together are known as the rotator cuff muscle. The Teres Major muscle originates from the inferior angle of the scapula. It inserts into the medial lip of the intertubercular groove on the humerus. It assists in internal rotation, adduction, and extension of the shoulder. The Trapezius muscle originates from the external occipital protuberance, the ligamentum nuchae, and the spinous processes of the C7 to T12 vertebrae. It inserts on the lateral third of the clavicle, the acromion, and spine of the scapula. The superior fibers function to elevate the scapula, the middle fibers retract the scapula, and the inferior fibers of the trapezius muscle depress the scapula. The Pectoralis Major originates from the clavicle, the sternum, and the costal cartilages of ribs 1 to 6. It inserts on the intertubercular groove of the humerus and is responsible for adduction, flexion, and internal rotation of the shoulder. It is made up of the clavicular part and the sternocostal part. The Latissimus Dorsi originates from the spinous processes of T7 to T12 vertebrae, from the iliac crest, the thoracolumbar fascia, and the inferior 3 ribs. It inserts on the intertubercular groove of the humerus in between the insertion of the Teres Major and the Pectoralis Major. It enables extension, adduction, and internal rotation of the shoulder. The Serratus Anterior originates from the lateral aspect of ribs 1 to 9. It inserts on the anterior surface of the medial border of the scapula. It helps to protract the scapula while holding it against the thoracic wall. Understanding this shoulder anatomy is essential for medical students, athletes, and healthcare professionals.